uh, it's an honor to be here with all the such great personalities and all the seniors and colleagues. First, I'd like to thank Dr. Sam for giving me this opportunity, and uh, and it's an honor to be here with all the professors, and especially Ken is here, so he's been an inspiration for this work. And most of this dissection was done by me and my fellow colleague Max Milano Nunez, who's also from Argentina. So he's made a significant contribution also here. So coming to the dissection and intrinsic brainstem anatomy. So most of this dissection.
Excuse me, your screen share is stuck. Can you
Oh,
reboot it, recharge it? Yeah, it's stuck. We're not moving at
uh,
all. Yeah, try it
okay,
again.
just
Just go over it again.
okay. Uh, this is actually new laptop.
Okay,
I'm using it
You
for
are
the
on.
first time.
okay.
So can everybody see it? So
Yes,
most
Yes.
of the section was done in the UPMC Pittsburgh, and some was in the KEM hospital in Mumbai. So brainstem, coming to the topic. So I will be talking about the intrinsic anatomy, as a Professor Matthias is beautifully shown on the landmark and external anatomy. So he's told us about the boundaries of the brainstem, how brainstem is connecting the cerebrum to the spinal cord. So it's just not a connection, it is just not a conduit. It is basically, there is a lot of reorganization of the fibers. If you see fibers, they start to have the decussation. There is motor decussation, there is sensory decussation, and there are a lot of gray matters which are involved, who give rise to almost all the cranial nerves from the brainstem, except optic and the olfactory. If you see from third to 12th, all the cranial nerves, they come out from the brainstem, and they have their nucleus in the brainstem. And only the fourth cranial nerve, which is rising posteriorly, most of them are arising from the ventral surface of the brainstem. So brainstem is a very compact neural structure with a lot of neurals, this anatomy. So you have to understand how these fibers are related to each other and to various surface landmarks. So when you are operating and dealing with lesions in these areas, of course, many times people say that in the pathology, you see all this anatomy is distorted, so there is no point. But if you see clearly, there is always a pattern which these pathologies follows. They have a way of growing, so they will displace the fibers, and these fibers will of course guide you to the lesion, to the safest possible lesion. This is the vision which we mostly use from posterior when we go from red suboccipital sides. So what I did was I tried to have this landmark from three aspects of the brainstem. So one is the ventral, which is the most prominent part of the brainstem. Then we have a dorsal aspect, which is the floor of the fourth ventricle. And of course, then there is the lateral aspect, which is the our CP angle and all other approaches. So if you see from this classical picture of the ventral brainstem, ventrally brainstem is very, pons is the most prominent region, if, as shown by, as we already know. So pons has a lot of transverse running fiber, and in between there is a this longitudinal running our efferent pathway or the motor pathway, which is very critical pathway, and we have to understand how it is related to other structure, so we can enter the through some safe pathway to deal with the pathologies which are intrinsic to the brainstem. So you can see cerebral peduncle, some pyramidal tract, then there is decussation, and then it goes to the lateral part of the spinal cord. So on deep dissection, if you see, once you take out this motor part, then there is a medial lemniscus, which is a very prominent intrinsic path. Again, it's a sensory system, which is after decussation, it's as a ribbon kind of. It divides the brainstem into dorsal and ventral parts. So this is also a critical part of the brainstem. Then you have in the midbrain, you have red nucleus. Then we have in the medulla, we have olives here. So coming to the dissection parts, as told by Professor earlier, there is a lot of crisscrossing of the fiber. There is superficial running transverse fibers. So these are basically transverse running fibers from one cerebellum to the other. and they can be divided into superficial transverse and deep transverse by the corticospinal tracts. So if you see the corticospinal tracts here, we have the medial part of the corticospinal, which is front. This is basically in the medial 3/5. We have corticospinal, and medial to it is the frontopontine fiber, and lateral is temporopontine. So this is how these peduncular fibers are arranged. So we can say this medial 1/5 or maybe 1/4. You can say it is little safer to have this access. So once you follow these fibers, they go into the pons, then into the medulla. So this is the deep transverse running fiber. Here you can see these are deep fibers, then there are superficial fibers. So if you are dissecting, you can dissect only in the one plane. You cannot dissect both planes here. So this is again, if you go more deeper, you will start seeing more of the gray matter and the long tracts of sensory lemniscus. This is again another specimen showing all the dissection from frontal view. So this is the deep view. Now you can see some part of the fourth ventricle is open. Then you have medial longitudinal fasciculus. Then we have central tegmental tract, and then we have our trigeminal, this long trigeminal nucleus with its tract. So there in the deep, you can see trigeminal tract going it's little lateral here. Then we have medial longitudinal fasciculus, central tegmental tract. And if you see this is all the, here we have opened all of the midbrain and some part of the pons and the medulla to show the roof of the fourth ventricle. You can see choroid plexus also. This is roof formed by the superior cerebral peduncle with the dentate nucleus here. So of course, this is not the practical view, but for the understanding, it is very helpful once you know how these three-dimensionally these structures are related to each other. Again, showing the same view with the, here you can see the optic tract here and the middle 3/5 of the corticospinal area with the corticobulbar fibers also included. And this is again the surface landmark. And this is how this now we are tracing the transverse fiber. So if you trace the transverse fiber, you can see this is corticospinal is medially located. So if you see the trigeminal, it is quite lateral here, and the facial nerve is here. So we have almost 3/5 of the peduncle, which is occupied by corticospinal tracts here. So dorsal brainstem, which is the floor of the fourth ventricle. So floor, again, very anatomically important area, because most of these nucleus, which are gray matters, they are pushed to the back because of the large efferent and efferent pathways which are running in the dorsal part of the brainstem. So many times we have to approach, which if the lesion is giving, this is the shortest possible way to reach here. So we have to know some safe zones which are classically described in the literature, and how they are related to various landmarks. We have a very prominent median fissure here. Then we have superior colliculus, and then we have the hypoglossal triangle here and the stria medullaris. So we'll try to see them in a specimen also. So on deep dissection, you can see how these nucleus are related to the your floor of the fourth ventricle. Of course, these are superior colliculus, inferior colliculus. Then this is the trigeminal here. So this is the lateral view. These are all classical picture we all understand, but just for a perspective, I have put it here. So this is the view of the same view with the dissection. If you see, this is the superior colliculus, inferior colliculus. This is the superior. This is the pulvinar here. We have here the pineal gland. And if you see this, the frenulum villi, which is the longitudinal extension of the cruciate sulcus between all the quadrigeminal bodies. And you have just below it the arising of the uh, trochlear nerve. And this is, of course, the here we have the lateral lemniscus and the superior cerebellar peduncle. So once you remove the part of the cerebellum, now you can see how these things are related. We have here is the inferior colliculus, trochlear nerve. These are superior cerebellar peduncles. And then we have the dentate nucleus here and the other cerebellar nucleus, which are related to this thing. So this is again now if I remove one side of the this thing of the superior cerebellar peduncle, you can say more of the dissection of the floor of fourth ventricle, facial colliculus, which is actually the nucleus of the abducent nucleus, and around which our facial nerve is going around this ascending part of the facial nerve. So it is technically a six nerve nucleus which forms the facial colliculus. So if you see on the one side, here is the facial colliculus, then you have sulcus limitans, and we have this locus ceruleus, which is the pigmented part of the trigeminal, this pigmented cells which form the dark area on the floor. These all landmarks are very helpful, but of course with the with all the pathologies, sometimes it is difficult to have them so clearly. But if you know this anatomy, you can have a better idea. So this is the stria medullaris here. Then we have the hypoglossal triangle. Later is the vagal triangle here. And we have our vestibular and cochlear areas, facial colliculus, suprafacial and infrafacial approaches. Of course, Khan will describe in his talk. So coming to the dissection again, this is again the, if you see it is narrowed down, if you go up, and these tracks can be very close to each other and not very safe area here. And similarly, in the below captus circumflex, like a very apex of this lower triangle, of course, all the critical nucleuses are there. So again, if you see from the side view, this is the middle peduncle. Boundary is, of course, fifth nerve. This is the pons, and after the fifth nerve, we have the middle cerebral peduncle, which are again transverse stunning fibers. On top of that, you have this lateral lemniscus, which is again a very important landmark with the lateral sulcus here of the midbrain, which can give you entry point into the brainstem. So this is a deep dissection. As you know, these transverse fiber, they just separate these corticospinal tracts into fasciculus. So these are small fasciculus. And we have lateral lemniscus, which is arising from trapezoid in the medulla and going to the geniculate bodies, medial geniculate body, and which is part of the auditory pathways. And then we have our sensory pathways, which is just medial to this. It's the deep dissection. So this is the lateral view. Here we have practically, if you see this fifth nerve, it is quite lateral. And it is on the upper surface of the pons. But of course, if it is in the middle of from the center, but if you see, it is in the very much on the upper surface of the pons. So this is the view. This is the trigeminal here, and we have the seventh, eighth nerve here, and the abducent nerve is more medial, which is in line with the hypoglossal nerve. So peritrigeminal areas are considered to be the safe entry zone to the pons here. Of course, this is the view from a cut section, substantia nigra again going to the lateral sulcus here. And if you see the faint impression here, you can see the red nucleus. And in between the red nucleus and your substantia nigra, this area we have the middle lemniscus here, which is then shifted upwards. So of course, the external arcuate fibers over the olives. Medulla again is a very narrow structure. There is practically, you see, there is no safe area here. It's all these structures they are very much close to each other. But this is the view of the cut section from the showing the roof here, and we have the sixth nerve nucleus here and the facial nerve here. So this is again showing the track of sixth nerve going into the pontomedullary sulcus here. So this is again a cut section with the cerebellum, roof of fourth ventricle, floor of fourth ventricle. And of course, this is again how this fifth nerve is related to rest of the pons and deep dissection. So technically we have very prominent corticospinal tracts running in the front, and we have lot of nucleus in the back. So if you know how they are related, then of course this is a helpful for approaching. And for approaching also you need access. There are all the nerves and arteries, small perforators around the brainstem. So this is again endoscopic view. You can see how this basilar artery is magnificently covering the pons here. Then it is vertebral arteries here. Then we have all the cranial nerve. We have the 12th nerve here. Then we have uh, 9th, 10th, 11th. This is the 7th nerve. This is again a loop of ICA going here. And we have 6th nerve very obliquely going, 5th nerve quite behind. This is a frontal view. So but just to show how this all cranial nerves and all the vessels are related. So just to approach that area, you also have to deal with all these nerves here. You can see basilar artery and vertebral artery cut section here, and this is the jugular foramen. This is from the behind. You have loops of pica here which will come in your way. You should know how to handle them, how to make a telovelar tonsillar approach, open the floor of the fourth ventricle.